handsome. So yesterday's program was really good. So nice.
Everybody appreciated it.
Yes. So
Not
nice.
even a single guy said bad about it.
Yeah. And each speaker was really good. All of them spoke really well.
Very good. Excellent program.
Yeah.
It so happened because of the lack of these two people.
It's somehow like everything came together in one spot. All of them were free on that day. No, if like one of them were not free, it would not have happened. So it so happened that, and all of them were willing to come physically. So that was nice.
And after a long time of gap, all of them are meeting again. That enthusiasm was there.
Correct. And Dr. Amar, are you there?
He has not joined so far.
Okay. So the screen is shared by TMA or?
TMA, sir.
TMA.
Okay.
Prasanna sir, good evening.
Good evening, sir. Good evening. Vinod Manjula, good evening.
Good evening. How are you, sir? How are you?
Fine, sir. Fine.
Good to see you yesterday. It's a long time.
Pardon?
It was nice to see you yesterday.
Yesterday, of course, after a long time, I came.
He was sitting in the front chair, very close to you.
Dr. Amar ഒരു 5 മിനിറ്റിനകം ജോയിൻ ചെയ്യാന്ന് പറഞ്ഞിട്ടുണ്ട്.
I got.
Actually, that was yesterday. It was the first meeting since March I attended.
No, everybody's case is so. I was not able to attend the physical meeting. We had one meeting at Casino, isn't it?
This is all due to Dr. Xavier. His persuasion only made me attend the meeting.
It is a collective effort, sir.
Okay, thank you, sir.
Okay. And you
Mr. Pratap, good evening.
Good evening, Pratap.
Pratap is there, I think.
Pratap has not joined.
Good evening, Vijay Kumar, sir.
Good evening.
Good evening.
No, sir.
So we just how each speaker outdone the other yesterday,
Yeah, it was a wonderful program yesterday.
Everybody liked it.
Everybody, yesterday's star was Dr. Xavier. Because of his humor.
Correct.
Which nobody knew. He was having such a tremendous
This
sense
is
of
first time that I have heard such a humorous talk from Dr. Xavier.
Yeah, same thing for me also.
Anyway, we can expect
He was keeping
more.
it.
We can expect more from him.
അത് ആവശ്യത്തിനനുസരിച്ച് ഉപയോഗിക്കും. എടുത്ത് കുറേശ്ശെ ആയിട്ട് ഇങ്ങനെ പ്രയോഗിക്കും. അതാണ്.
Correct, sir.
ബെസ്റ്റ് മാനേജ്മെന്റ് ടെക്നിക്കാണ്.
He is a management expert.
അതെ. നല്ലതാ. 2021 എല്ലാം കൊണ്ടും TMAക്ക് നല്ലതാവട്ടെ, ലോകത്തിന് നല്ലതാവട്ടെ. TMAയുടെ ബെസ്റ്റ് ടീമുമാണ്. Everything will be turning out to be very good for that team.
Surprising raining today.
Yeah.
Raining.
No, it's good. It was so hot.
ഇന്നലെയും ഒരു ഫോർകാസ്റ്റിൽ ഉണ്ടായിരുന്ന തൃശ്ശൂർ thunder shower. But yesterday nothing happened. Again today it is there. ഇന്ന് മഴ പെയ്യുന്ന ലക്ഷണമുണ്ട്.
Here. It's not raining there?
No, here it is not raining.
ഇവിടെ TMA ഓഫീസിന്റെ അവിടെയൊക്കെ റെയിൻ ചെയ്യുന്നുണ്ട് ഇപ്പൊ. ടൗണിലൊക്കെ ഞാൻ കുറച്ച് റൗണ്ടിലായിരുന്നു.
ഇവിടെ ഞങ്ങളുടെ വലപ്പാട് ഏരിയയിൽ there is no rain.
Shajid sir, immediately after his arrival, we will start the program.
Yeah.
നേരെ എറണാകുളത്താണോ സംസാരിക്കുന്നത്?
തിരുവനന്തപുരം.
ട്രിവാൻഡ്രത്തുനിന്നാണ്.
ഒരു 5 മിനിറ്റ് മുമ്പ് വിളിച്ചപ്പോ 5 മിനിറ്റിൽ ജോയിൻ ചെയ്യുന്ന പറഞ്ഞേ. പുള്ളി ജസ്റ്റ് വീട്ടിലെത്തിയിട്ടുണ്ടായിരുന്നുള്ളൂ.
You must be a very busy person. Being a,
ഓഫ് കോഴ്സ് ഇപ്പൊ ബേർഡ് ഫ്ലൂവിന്റെ
Order.
ഇതുണ്ടല്ലോ ഓൺസെറ്റും കൂടി
6:30 ആയിട്ടില്ല.
3 more minutes അല്ല
3 minutes left.
അല്ല 6:20 ജോയിൻ ചെയ്യാൻ റിക്വസ്റ്റ് ചെയ്തിരുന്നു നമ്മള്.
അതെ, ഓക്കെ.
ലാസ്റ്റ് മിനിറ്റ് കൺഫ്യൂഷൻ അവോയ്ഡ് ചെയ്യാൻ വേണ്ടി.
ഇപ്പൊ പിന്നെ ഹൈറ്റ് ഒന്നും ഇല്ലല്ലോ, അതുകൊണ്ട് പിന്നെ സമയത്തിന് ജോയിൻ ചെയ്താലും മതി.
അതെ.
Submitting the people inside. Someone is in charge.
Hello.
Yes.
Good evening, sir. Good evening.
Hello, good evening, Achyuta Menon.
Yeah, good evening, sir.
Good evening.
കുറച്ച് പേര് യൂട്യൂബിലേക്ക് പോകും. I think some
Oh.
people will go.
I tried YouTube. I was not getting connection.
Yeah.
Ajay sir, hearing. Pradhamarki, are you present?
Oh, it's all right.
Pradhamarki,
2 minutes more.
Shadi sir, good evening.
Yes.
2 minutes.
Francis.
Haji, good evening.
Hello.
Haji, can you
Yes,
hear?
good evening. Good evening.
You're trying to say something?
Yeah, we should mute. I think the TV, someone's TV sound is coming just so. Before the program starts, just remember to mute everyone. Not now.
Right. Yeah.
I think Prathavarki is not there. It's not joined.
He'll be joining. Bob is joining.
Okay.
So within 1 or 2 minutes, we'll start the program. At any time.
Francis, can you mute all Francis?
Yeah. I've muted everyone. Whoever is going to talk, please unmute yourself.
Shajan sir.
It's at 6:30 now. We are waiting for Dr. Amar to join. He just got home 10 minutes ago from a busy meeting. So he's going to take a couple more minutes to get ready and join us. He'll be with us soon.
Okay.
So please wait with us. Please be patient with us.
Francis, can you hear me?
Yes,
Okay.
Shaji.
Okay.
Pradham,
Yes, good evening.
Devi sir. We were waiting for you to start this program.
Thank you.
Hey, without honorary secretary, how can we start it?
Secretary.
So Dr. Amar has joined.
Yes, Dr. Amar has joined. Hello, Dr. Amar. Have you joined us?
Welcome, Dr. Amar. Dr. Amar, are you present?
Yeah, I'm here.
Oh, sir.
Okay, welcome.
So I think we'll start the program.
All right.
So
Okay, so Dr. Amar has joined us. Good evening, everyone. My name is Francis George. I'm the Master of Ceremony for this evening. I am the Joint Secretary of Thrissur Management Association, TMA. Am I audible to everyone?
Yes.
Yes.
Okay, good. All right, let's get started soon. Before we start, a couple of things. If you're not speaking, please do mute yourself when this program starts. I'm going to mute everyone, in fact, right now, and with the option of unmuting yourself. So when it comes to your turn to speak, please unmute yourself. And for the benefit of the participants, we're going to have a question and answer session at the end of this after Dr. Amar's presentation. Whatever questions that you may have, you may please type it in the chat window, and then we will cover them one by one, as our time permits. With that, let's kick off this meeting with a silent prayer. Thank you. May I call upon Engineer Vinod Manila, the Senior Vice President of Thrissur Management Association, for the welcome address.
Good evening, all. Am I audible?
Yes.
Okay, thank you. President of TMA, Dr. VM Xavier. Chief guest of the day, Dr. Amar S. Fettle, the State Nodal Officer for COVID-19. Mr. Paul Thomas, the Vice President. The Honorable Secretary, Mr. Pradhav Workhi. Honorable Joint Secretary, Engineer Francis George. Our Treasurer, CA Shaji, PJ. Our CEO, Gio Job. Past Presidents of TMA, MC members, members of TMA, student chapter members, invited guests, ladies and gentlemen. This evening, I have the pleasant task of welcoming you all to the very important and need of the hour topic, COVID pandemic management, a Vista for strategic management. This year, our president has kickstarted 2021 with a high decibel event. I'm sure many of you would have visited. We have witnessed this program last evening. For the first time in the history of TMA, the heads of 5 financial institutions of Thrissur attended the program, and it was highly appreciated. Do keep up this tempo, President, and I warmly welcome you to this meeting. Dr. VM Xavier, welcome you. COVID has come like an avalanche. Before we could understand what was happening, it swept across India. It created confusion and chaos. And amongst this chaos, there was Dr. Amar and his team working calmly to bring things under control. I would like to welcome Dr. Amar S. Fettle to this meeting, and he will be speaking on the topic, COVID pandemic, a Vista for strategic management. He's under tremendous pressure. He's not have time. In spite of that, he has come thanks to the invitation. I welcome you, sir, to this meeting.
Thank you.
I would also like to extend a warm welcome to the office bearers, past presidents, MC members, student chapter members, members of TMA, and invited guests. Remember, our race against COVID is not over. We may be close to it, but the last mile is very, very important. With these few words, I welcome you all once again. Thank you.
We will proceed now. From here.
Yes, sir. Wait.
Sorry, I was on mute. Thank you, Engineer Vinod. May I call upon Dr. VM Xavier, the President of Thrissur Management Association, for the presidential address.
Good evening. Chief guest of the Dr. Amar S. Fettle, the Nodal officer for COVID-19, Government of Kerala, Senior Vice President, Engineer Vidupajana, Vice President, Mr. K. Paul Thomas, Honorary Secretary, Mr. Padamarki, Joint Secretary, Engineer Francis George, Treasurer C. Shaji CJ, CEO Geo Job, and past presidents of TMA, managing committee members of TMA, members of TMA, student chapter members of TMA, ladies and gentlemen. The 2021 program we kickstarted yesterday. Our senior vice president told you it was a big, was a mega event. Nearly 150 people attended that program. All the stalwarts of the banking industry and finance institutions came there. Other than those people, there were a number of other CEOs, like our senior vice president, Vinod Bajila, CEO of Bajila's Foodtech, our honorary secretary, Pradhambarki, MD and CEO of Sun Medical and Research Institute, then Mr. Engineer Christo George, MD and CEO of Hyken India Limited, and then Ramakrishnan, the MD and CEO of Sherman Securities, so many directors, MDs. It was a unique meeting yesterday. And all the people appreciated the program. And today we have another program. That program is headed by Dr. Amar S. Fettle. Dr. Krishnamurthy, our managing committee member, and our member, Professor Philip Sabu, they told me that there is a very good speaker called Dr. Amar S. Fettle. By profession, he is a pediatrician. He took his MBBS and PG in pediatrics. But by passion, he is a warrior in the battlefield of the preventing of the viruses like COVID-19, Nipah, H1N1, all kinds of viruses. And he was very successful in that. That may be the reason why Government of Kerala is appointing him as the nodal officer for COVID-19 again. And let us listen to Amar, Dr. Amar Fettle, and I'm sure it is a wonderful talk because the two persons who suggested his name are already the members of Thrissur Trainers Club Forum. So they will be inviting or they will be suggesting only if that person is so capable. So we are lucky that today we are getting Amar S. Fettle, who will be talking on COVID pandemic management, a Vista for strategic management. Dear my friends, this month we'll have so many other programs. On 13th of this month, we have a program by Engineer Sanjeev Amar, Chief Business Officer and Director of Alpha Ori Technologies, Singapore. He's a Malayali by origin, but settled in Singapore. And again, on the third week or fourth week of this month, a Sanjay Kumar IPS, who is the DIG of Kerala Police, will be addressing the members of TMA on cyber crimes. And in February, as I told you yesterday, Murali Ramakrishnan of the MD and CEO of South Indian Bank will be addressing. A lot of other people are on the queue to address the members of TMA. We have a brand name and all the people are happy only to address the members of TMA. So I don't want to take much of the valuable time by talking about TMA and its activities. I wish all the best for this program. Thank you very much.
Thank you, Dr. Xavier, for the presentation address. May I now request the President, Dr. Xavier, to introduce the new members who were inducted into TMA.
Dear members, dear participants, yesterday in the managing committee meeting, we have passed the membership of 5 people, out of which 2 of them are women and 3 of them are men. And again, out of the 5, 2 of them have some military exposure. One is Dr. Captain Sushila Menon, and another person is Captain Rajendra. And we had 2 chartered accountants and 1 woman who has qualified intermediate of company secretary. Dr. Captain Sushila Menon, by profession, she is a professor in Sri Kerala College. She has retired from Sri Kerala College. Now she is the guest faculty in a number of new schools like Elite Institute of Management Studies, Academic Center, Leeds Management Institute. And above, she is the director, only women director, independent director of the people. So welcome to Thrissur, Dr. Sushila Menon. Welcome to Thrissur. Then we have got 2 chartered accountants, one Rajesh Parmeshwar and C.A. Krishnadas. Both of them are chartered accountants. They have been recommended by, one of them is recommended by, Krishnaraj was recommended by Engineer President, and Rajesh Parmeshwar, he was recommended by our own MC member, Then again, one more person is there, that is Lieutenant Rajendra Babu, who is still working in the military project as the senior manager. His name was recommended by So welcome, Lieutenant Rajendra Babu. Welcome, Dr. Captain Sushila Menon, Chartered Accountant Rajesh Parmeshwaran, Chartered Accountant Krishnaraj P, and this is HP Badhu. The quality of members are very high this time. We get very highly qualified professionals as the members of TMA. Next month also there are a number of people waiting in the queue to be the member of TMA. Very soon we'll get more, we'll be touching the target of 500 members. So once again, I welcome all these people to TMA platform. Thank you very much.
Thank you, Dr. Xavier. May I now call upon our treasurer, honorary treasurer of TMA, CA Shaji PJ, to introduce our chief guest of the day, Dr. Amar Fettle.
Good evening, everyone. Am I audible?
Yes.
Yes.
Okay. Respected President Dr. V.M. Xavier, Chief Guest of the Day, Dr. Amar S. Fettle, and my colleagues in Thrissur Management Association and invitees. About our chief guest, Dr. Fettle, Dr. Amar S. Fettle, is the Nodal Officer for COVID-19 of the state of Kerala, has been spearheading the state in the fight against communicable diseases, including COVID-19, for a decade. Dr. Fettle began his medical profession in the health department in 1988 after graduating MBBS from Medical College Trivandrum. He holds a post-graduation in pediatrics. He had served as a medical officer in ESI and Tribal Health South Zone for 8 years. He was appointed the district physician AIDS management in 1991 He was the consultant resource person for institutions like University of Kerala, Kila, and Southern Air Command, amongst others. He was designated as a state nodal officer for H1N1, MERS-CoV, avian influenza, Ebola Zika virus, and Arogya Kiranam program for the adolescent health. He has undergone advanced training in neonatology, HIV, AIDS, counseling, etc., by the prestigious national and international institutions. He has designed a host of training modules on HIV/AIDS, H1N1, and Ebola virus diseases. He was a guest editor of Journal of Teenage Care and Premarital Counseling. He is the recipient of Good Service Entry from the Kerala State for the meritorious service as the state nodal officer for H1N1. He received it for the effective control of the H1N1 pandemic. Dr. Fettle contributed significantly to the research and training programs associated with important bodies like UNICEF, KHA, SCRT, KILA, CDC, RGNIYD, and many more. He has served as the president and secretary of the Indian Academy of Pediatricians. These are the few I have introduced him in a very short this thing. So, he has got more things to say about himself, but due to lack of time, I am restricting this to this much. So, Dr. Amar Fettle, welcome to the TMA webinar.
Thank you, Yashaji, for the wonderful introduction. Now, everyone is eager to listen to Dr. Fettle, who is an eminent speaker, well qualified. Before I hand over to Dr. Fettle, may I request everyone to mute yourself? In fact, let me mute everyone. So I would request Dr. Fettle to unmute himself. And then before he starts speaking, I'm going to mute everyone now. And one more thing, while Dr. Fettle is making his presentation, if you happen to have any questions that crop into your mind, you may type the questions into the chat box. And towards the end of the session, Dr. Amar's presentation, we will cover the questions one by one as far as the time permits. So I'm going to mute everyone now. Dr. Fettle, please unmute yourself and begin your presentation. Thank you.
Sorry. Good evening, ladies and gentlemen. It feels great to be here addressing a very august audience like the TMA, especially endearing because based at the city of Thrissur, because Thrissur is the place where my wife belongs to. So I've also been in Thrissur, as I worked also in Thrissur for a significant period of time in the hospitals there. And the place has become so dear to me. And now I would also like to take anticipatory bail, because I heard someone talking about the muting of. I might get emergency calls, because my job is to answer every emergency call immediately and give them some solution. And there are some crises going on in the state right now, so I might get calls. Hope we won't be disturbed too much. Many of the calls might be looked after by my assistants, but some might come to me. And Francis, what are the time that we are adhering to?
It's 30 to 35 minutes. If you can finish within that, well and good. We can.
So by 7:30 we will stop. So before 7:30 we will stop the presentation. Okay, is that okay?
All right. Yeah, that's fine.
Okay.
Thank you.
So I'd like to say thank you to all the distinguished office bearers of this TMA for inviting me. A lot of encouragement from Francis, who's been calling me now and then, and also Dr. Krishnamurthy, Dr. Philip Sabu, and people who have been so encouraging that I thought, yeah, we will. It's a frightening thing, because for us doctors, fields outside our profession are a bit what you call, make us very, very afraid to speak. Anyway, we will go ahead, and I will be talking about the efforts that we have taken over the time, last 1 year, about in battling COVID. I have some slides here, and hopefully we will look at the slides and go along with that. So let me just start my slides screen sharing.
You can see the screen now.
You can see it? Okay.
Yes. Dr. Amar, you may want to put it to a
trying to
slideshow.
make it full screen.
Try F5.
Yeah. It's okay now?
Yes.
So it's been a long year. 12 months have sometimes this past 12 months or 11 months seems like a few minutes. At other moments, it seems like 10 years. So the pace of things that has been going on has been very, very astounding. And we are really on one side humbled and one side happy that we have been able to do our best and show our best side in the battle against COVID so far. We have had to resort to all kinds of strategies so that the picture signifies all the adavugal and the steps that the moves that Kalari warrior takes. So in fact, many of these things that we have been doing incorporate a lot of multitasking, because you know that in Kalari, ഇടത്തോട്ട് തിരിഞ്ഞ് വലത്ത് വെട്ടുക, വലത്തോട്ട് തിരിഞ്ഞ് ഇടത്ത് ചാടുക. So all sorts of things happening simultaneously in the blink of an eyelid. So that's the kind of things that we've been trying to do in the health services and also our along with our converging departments. In fact, we started off even before the government of India gave us our announcement, because we were looking at, we have a division for surveillance. So it's something like the radar which you see on ships and in airports and all that. We see this radar antenna which is rotating all the time. So we have such a system in the health services. It's called the IDSP, or Integrated Disease Surveillance Program. And the job of this is very simply to say, keep an eye on whatever is happening around us in the disease field all over Kerala. This is a national system, so every state has its own IDSP division. And we look after everything. This division keeps a very close watch on everything that's happening around us. We take inputs from laymen about suspected illnesses, suspect anything unusual. We take inputs from health staff, we take inputs from specialists, we take inputs from labs. So all these inputs together converge in the IDSP system. And we finally arrive at decisions whether some disease is a suspect, or whether it's more probable, or whether it's confirmed. So that way we have a very close finger on the pulse of the disease status of the state. And the IDSP system, and we have a division called Public Health inside the Directorate of Health Service, where I now work. So that division also looks after it's the division where we as a team look after the disease prevalences, the trends and the rates and the projections and predictions and everything. It's very dynamic because it works throughout the night and day, and decisions keep on getting made and unmade all the time. So it's very dynamic in nature. And we had received some news from WHO and all that. We saw on their sites that something funny is happening in China, and some new virus is getting prevalent there. The people are under a sort of scare situation, and some hospitals are having patients with new kinds of pneumonia. And all these things were happening on by December end. So we were keeping a close watch, and when this word China kept on coming up, the thing that came to our mind was that China means that there are so many students in Kerala who study in China for medical education, paramedical education, all these things. So what we wondered is that now maybe they'll come back. Isn't it possible that they'll come back very fast? So we decided here to alert all our districts. So in fact, our first warning to the districts went out, I think, slightly before the Government of India warning started coming in. So I remember writing up that message that something funny is going on. Keep a watch on people who are returning from abroad. We didn't mention China. We said anybody who's returning from any other country and anything unusual in the country in your health centers about fever case and all that, keep a close watch. Immediately after that, we received a notification from the Government of India, Ministry of Health and Family Welfare, that this official warning has come from WHO, and we will need to start surveillance at airports. Now, the airports, when there is an international outbreak, some other country, naturally we expect that people from that place will come back. And travel is so widely done nowadays. It's not like olden times when people used to depend on ship and land and all that. But now the aircrafts have made travel, they have shrunk the world. In fact, you can get anywhere in 12 hours and 24 hours, you can be around the world maybe. So that way, whatever happens, wherever it happens, in no time it will be here also. So we immediately launched what we had been done earlier. So this airport and harbor surveillance and screening, that we start off immediately. This also was well prepared because for the last several years, from 2009 onwards, we have had the system of airport surveillance. When there was a crisis, it would go into peak mode or top gear, and other times, peace times, it would go into quiescent mode. So this system was there, the people were there, the arrangements were there, everything was there. So we just had to switch on and reorient people to start the whole process. So the airports and harbors where international carriers would come in, bringing passengers and goods. So we started the surveillance there initially. After quite some time, when this became a national issue, then road and rail surveillance had to be started. But at the airports, what was done was taking temperature of people, asking them questions, having them fill forms, and analyzing the forms and analyzing their symptoms. And anybody suspect and anybody arriving from a suspect destination like Wuhan or China, they were all advised to remain in quarantine. Some people were shifted to institutions, and we asked them to be in room quarantine. What does quarantine mean? Suppose somebody has been exposed to a disease and you don't know whether you will get it or not, and this disease is not prevalent in a country, then we do something called quarantine. We wait for double the amount of time that it normally takes to develop. Usually every disease, they develop symptoms within a certain fixed time. For example, measles, usually you get it within say 2 to 7 days or something. Chickenpox, you might go up to 21 days. So every disease has its own sort of period within which you develop symptoms. And that period is called the incubation period. So we wait for double the incubation period and put that person in a place where he cannot have contact with anybody else. So that is the word quarantine. So a person, an ordinary person, not diagnosed, we are just waiting, that is quarantine. On the other hand, there's another word called isolation, which is suppose a person has symptoms and is confirmed, then we put him separate from other people, that is isolation. So anyway, we started off all these processes at the airports and the harbors. Kerala is a state which has 4 airports in such a small area. So you can imagine the number of people that have to be screened. It is in lakhs, in fact. Then the other thing that we anticipate, we were well prepared is that the projections and extrapolations, because we had done this earlier also for different international viral emergencies like H1N1, then for Ebola, for SARS-CoV, then for MERS-CoV, for the Zika virus outbreak in Singapore. All these things, we had done these things and looked for worst case scenarios, because we need, when preparation, we more than achievements, we need to figure out where we are likely to go wrong and where we are likely to face bottlenecks and where we can mess up. Just like Murphy's law, if something can be messed up, it will get messed up. So following that, we look for the worst case scenarios. Instead of resting on laurels and being reassured, we look for the worst case scenarios and analyze the gaps which are there. I'm sure that many of these things are what the strategies that are followed in management approach for a company or an industry or anything like that. So these were some of the areas where our preparation paid off. we were so well prepared in all these areas that we were always one step ahead of the virus at all times. So that was the first part of it. Second part is that the virus arrived. I will remember that date forever because it arrived on January 30th. And January 30th is the date when I had to rush to Thrissur because my daughter was started labor pains and she was going to have her first baby. And she was admitted to hospital on January 30th morning. So I rushed from here. I told the officials in charge and the directors and secretaries and told them that I'll be rushing. And so I went off to Thrissur suddenly. And guess what? The first case in India turned up in Thrissur itself. So that was very surprising. And there were so many jokes that I had to bear that when I rushed to Thrissur, the COVID also followed me there. So that was the January 30th when this first case cropped up. By evening of January 30th, all our senior officials, including our Honorable Minister for Health and Family Welfare, our K.K. Shailaja teacher and other ministers, many of these people, top people, had rushed to Thrissur immediately. So by night, I think by 2 a.m. itself, we started off our planning meetings, and the first war room in India against COVID was drawn in the collectorate at Thrissur, where all of us got together there. And I was in the hospital with my daughter, but by morning 6 or 7 o'clock in the morning, I also arrived at that place. And all the senior people, the collector, everyone was there. And we started off operations on the first scale in India there. So we had decisions about how to isolate, how to quarantine, what rules to be followed, how we will do the testing, what we will do with other people who had arrived in that place, what are the answers we need to give the press and all these things. So that we started off there. And as time went by, after a gap of, in that first phase, we had 3 people, one in Thrissur, one in Alappuzha, and one in, they were all students, one in Kasaragod. So, and after a gap of about a couple of 2 weeks, 3 weeks or so, then the flow of patients started. And then at that time, by that time, we had already set up something that we had done earlier for other diseases. So this multi-divisional control room was set up immediately in the Directorate of Health Services. Multi-divisional or multi-department, multi-component means there are a lot of things in the control of an epidemic. For example, one is that patients need to be managed. So everything that the care of patients that somebody has to look after. Then testing has to be done. So sampling and testing and getting of results and consorting results and all that, that's another part. Medical treatment and the infrastructure for that, the medicines for that, everything that is yet another aspect. And in the meantime, the media, everyone will be in a frenzy. So communication lines with the media and other people. Having a single spokesman is very important, that we always had a single spokesman. And I'm very honored to say that I've been the single spokesman for a lot of international emergencies since 2019. So that is to avoid confusion. And all the inputs come to one person, and that one person deals with the press on a daily basis, press and media on a daily basis. So a lot of trust is built up. So trust is another thing that is very, very important. Trust and openness, what the Russians used to call glasnost, or openness. That was something that really won over the hearts of the press and the media. And we became very good buddies. The media and the department, in fact, have been good buddies ever since 2009, when we really went into a hyper-transparent mode. Anything that happened in the state on the disease front, earlier it used to be hidden, and the media would have to dig it up. And then they would be very loud in their digging up. And so we proposed a policy of total openness, so that everything, however unpleasant, we would reveal to the media. Then finally, so much of trust was built up that the rumors came down, the dramatization of unhappy events, that also came down. The media became much more factual, and was so much on the public side that every advice was conveyed to the public in a very digestible manner. Also, so that's another division. Sorry for digressing there. Then ambulances transport, because such patients with a rare disease can't be transported in their own vehicle. So we had to have entire fleets of ambulances all over the state, which were running with precision from point to point without wasting 1 second anywhere. So a huge fleet of ambulances and their ambulance technicians, ambulance drivers, a huge army of people there. Then we had the social media, which is now a complicating factor, where for anything there is no there are some people with a twisted mind who have no hesitation in churning out rumors of all kinds, alarmist rumors, false things, and all sorts of the most horrible rumors are churned out by some people who seem to enjoy all the distress that they're causing. So we had to have a social media monitoring group who would look at everything, spot the dangerous things, and then negate them, and even go into taking action against people who tried to scare the public in this manner. And we also established that what we call effective management here, lines of command. So the control room is there, and the command has to go down to the most peripheral level. So right from top, where you have the initial commander for all of us, it was then and now our own health minister who was there sitting with us. This is something that I say with admiration, because usually we would say in the department that any decision we have to send up to government and get approvals. But here we found, not to our amazement, we knew that that would happen, but the minister was sitting with us. She used to come over. She abandoned her own room and the secretariat and all that. And most of the time she was sitting with all the doctors and other staff in the control room inside there in the Directorate of Health Services, discussing things and taking decisions on spot, everything on the spot. So we never had to send anything up to government and wait. The government was sitting along with us. So then it was a very amazing experience. So that kind of command. And from there, through the Principal Secretary of Health, and then right down to the Directors of Health Services, Director of Medical Education, Director of Insurance Medical Services, things came down. And also then the command then further went up to the Chief Minister later on. And so there was a very strong line of command there. And from the director, it would go down to district medical officers. We have 14 districts, so 14 district medical officers and their teams. So from there, every decision would go at lightning speed to the doctors at the peripheral level. Even a doctor in the most remote village would get decisions by email and by WhatsApp immediately as they were taken. So there was no delay and confusion. We also immediately produced the guidelines. I remember the first guideline was prepared so fast. We wrote the guidelines. I still remember composing the guidelines for the whole thing. And the first guideline was published just before, I think 4 days on Republic Day. And the first guidelines in the whole country for COVID was published by Kerala State on Republic Day. It was approved and published on that day itself. So that is the first guideline. I remember penning down every line of that. And then the troops are the people who really face the brunt of the battle everywhere. Whether it's a war or a battle like this one, they face the dangers, they face the bullets, they face the grenades, they face all the, they are at the risk of getting infection, death, and everything. They are really, and they are always at risk of extreme of fatigue, no rest, no food, no family, everything was gone. With one stroke, everything disappeared, because they were on work 24/7 all the time. And but this is our own troops, our own doctors and nurses, and also frontline. Other than the frontline, we have something behind the scenes. There is a field staff. So this is another group that I admire, the field staff, people like health inspectors and others who work among the public, belong to the health service, and they work among the public at the primary health center level. So many things had to go to the public, had to be communicated to the public, home isolation, a lot of things. So the field staff also were on continuous work. And because they were all dealing at close quarters with a contagious disease, new contagious disease, they also had to be on away from their family all the time. So this was the kind of battle lines that we drew up initially. Just like having the Air Force, the Navy, and the Army, we had all these people. And also then we had other departments. I think convergence will come to. So ground staff, yeah, field staff I have mentioned here. Ground zero is where the actual battle happens in the community. People coming in through airports or through land transport and arriving at a house and then getting a fever, and then somebody testing and finding out that is COVID. So you have a person sitting at a house in an ordinary place and then detected as COVID. And from that point onwards, the field staff take over in providing aid, giving them advice, monitoring them, visiting them daily, and maintaining a constant telephonic communication with them so that they don't get scared, they don't get depressed, they don't make any mistakes. So dramatic and heroic work by the field staff there. Then the ambulance and vehicle teams, yeah, they were both our own ambulances. We have a huge number of ambulances. In fact, health service said to be one of the departments having the biggest number of vehicles, but we still had to commandeer other ambulances also. Hospital staff, dedicated work, everyone. It's not only when you say hospital staff, usually we think of doctors and nurses. But here there were so many other categories who were away from home. So just one of the things in the management of these people were so many kinds of duty lists and giving them enough rest. So how many off they would get, what time they would they would be given duty off, and then when they are off duty, where they can't go home because they have been in contact with COVID. So we had to find out special accommodation for them. All these things were never done before, and even we commanded hotels to house them. We had to make food and other arrangements for all these people. So there were so many teams looking after these aspects exclusively to avoid confusion. The laboratories, again, we had so many. Initially, there was only one laboratory for India, that was the NIV Pune. Then we had we rapidly built up our own state laboratories. Then next into a phase where 2 laboratories, NIV at Alappuzha and Rajiv Gandhi Center at Trivandrum. Then, because we knew that the load would increase, we had managed to have laboratories all over the place. So now we have several hundred laboratories, both in the private and public sector, who are looking. And the teams there, they have been working throughout the day and night, because people have to be tested all the time. And these lab teams also they're at risk, and also we're working all the time. Other departments, we can't forget mentioning the police. So we had so many convergence modalities with the police, because getting people to obey things by their own, sometimes we can't wait and take a chance. And our public, or any public for that matter, is notorious to break rules. And this is a place where you can't take a chance. So we had to have our own enforcement, and the police gave us wonderful cooperation in ensuring containment zones, red zones, and traffic quarantine management, curfew management, lockdown management. All these things were done by the police. So that was another area of convergence. The revenue department, you will know that the state was able to provide so much of food and other social security components to all the people who were stuck during the lockdown without their jobs, without income, and those things, the ration kits, everything was a relief. For daily salaried people, it was not much of an issue at that time, because they would get their salary. But for the people who were earning their wages daily, it was a real horror story. And it was there that the revenue department and the food and other food supplies, civil supplies, and other people chipped in to help those people in distress. So that also, so we had, when other departments came in, that is where the role of our chief minister and other principal secretary, chief secretary, and other people came in, because commanding other departments do what has to be done. The health department couldn't do, so can't do, in fact, by rules. So we had people above us also converging everything together. So this was the kind of battle that took off at that time. This guidance is a very important strategy for perfect management, because without that, people would be doing what they like and what they guess which is right and all that. And so many mistakes would be made, and here is one field where mistakes can't be made. We always make jokes about surgeons in operation theaters. You cannot say the word oops, because if you say that, something has been cut. So in this field of virus fighting and crisis fighting, pandemic fighting, every mistake can be fatal, can have fatal consequences for somebody. So in order to avoid that, I talked about the first guidelines. So these guidelines, from that moment, Republic Day, January 26 onwards, we produced, I think, several hundreds of guidelines dealing with every single aspect of COVID management, starting from primary detection, quarantining, isolation, all that side on one side. Contact tracing, you will remember that route maps and all that. It was an innovation by some of our young doctors, route maps. Talking about route maps, in fact, finally we got a compliment from the police and other people that the doctors seem to be outdoing their investigating methods, because our young doctors who are tech savvy, they develop so many strategies to use GPS, using phone records, using all kinds of things to triangulate the movement of people who are not cooperating. So we were able to detect people who are running away, not revealing their whereabouts, not giving us their travel history. So contact tracing, there were advisors on that. Then about simple things like how to prepare bleaching powder solution, how to disinfect a place, and at the other end of things, how to bury a body, how to handle a dead body, what kind of ceremonies could be done and not done. So standard operating protocols, so many hundreds were released by the Department of Health. Other departments also had their SOPs, but they were all based on our guidance. So, so many SOPs were released by the government at this time. And that was to smoothen the course and to avoid mistakes and make everything very standard. The other thing about guidance, official guidance with everything had the Kerala government emblem and all that for authentication, so that everyone knows that this is the right one and it's not a false thing. Because at this time, there were a lot of false things being put out also by the social media. Then we have our own lines of dissemination, email, WhatsApp, and all the things which we never had earlier. These are all routes used to disseminate things at lightning speed to the most distant doctor or medical team. The state also formed a think tank, a policy developing think tank, to keep on dynamically thinking and analyze everything that is happening day by day, so that many of our decisions we had to redo and revise at appropriate times. Many of our guidelines had to be revised at different times. And this think tank was composed of people with a lot of experience. It's an expert group was made to fight the battle. Communication for health, very important strategy in the management of disease, control of our pandemic control, because everything, public and other people had to be informed about all the what you call policies, the methods, the guidance, and all that, and trained about safety. So for that, information, education, and communication on specific issues, and also general communication via newspapers and TV had to be done all the time to reassure people and to keep them on the right track. So it is during these IEC strategies and policies that some words like break the chain came in. I think Kerala was the first state which came out with the word break the chain, which composed of three things: the using of a mask properly, keeping our hands clean all the time, and maintaining physical distance between people to prevent transmission of the disease. And the smartphones and tabs and all modalities were used. We also had non-stop talks on radio and TV and all that, and so that the people would know that the department is with them closely, and anything we are ready to face, challenge, and solve for their benefit. Very, very important part of strategic management of an epidemic is the data collection and reporting and analysis. It's of utmost importance because it's on this which is on which we base our next day's activity, our next day's policies, revision of rules, and everything was based on data collection. And so this has to be standardized. There were so many formats, so many kind of charts and reports and all that, and all these. There was one division looking exclusively after these things. Following the contacts of travelers, following their history, so many components to be followed. So it was a huge team of doctors and helping staff and the ministerial staff sitting with us, doing the data collection and doing the analysis live all the time. This also was going on throughout the night and day, not only during the daytime and working hours. It was happening through the night and day. And we all used to be online throughout night and day to monitor what is happening. And there was a fixed flow of data from periphery through the district head, the district medical officers, and the district program managers. It would come up to the state level headquarters, the state headquarters at Directorate of Health Services and National Health Mission, where the whole team was sitting together to analyze and see what to do next. So data collection, a very hard job. So much of labor was involved in this data collection. And it also caused a lot of stress among the peripheral health workers, because there were a lot of requests were made to them, directions were given to them all the time to report this, report that, find out these numbers, count those people, trace these people, track those people, find out what is happening to them. So many directions were sent to the peripheral people. Media handling I talked about earlier, but live news, something very important. So handling a live discussion, pretty challenging task, because it's just like playing cricket. You don't know what kind of ball is coming, but it is something that we have now got used to. And our select team of experts who go on air on the TV and radio are well trained and well equipped in their information and awareness and capacity to respond to questions without getting flustered or without getting provoked. So that is the kind of team we have for media handling. And as I said earlier, I would like to repeat that the media has been so responsible, and sensationalism was not much of, was not very visible. In fact, it disappeared for a big extent. There was no sensationalism in Kerala. Everything was very factual most of the time. Another very important strategy which we used and which helped us so much was the helplines. Now, people sitting in the community and the department are far apart actually. We wanted to bridge this gap, and it is for that this helpline came up. This helpline has been there for long before the COVID episode. It came up several years back, primarily to address the issue of student suicides and depression, because this used to happen after the public exams. So at that time, this direct intervention system for health awareness was created, and the acronym DISHA stuck. So DISHA 1056 is the toll-free number. The main number that is we would recommend using is 0471 255 2056. I would request and recommend that all of you please be kind enough to save these numbers on your phone's contact list using the name DISHA, and then disseminate this through all your friends and family and everybody, because this system, it's a huge call center which we have here in Trivandrum, and it is staffed by, at that peak time we had at least 70 people sitting on the lines, on the computer lines with headphones and all the whatnot, answering calls throughout day and night, 24/7, no break, no gap, no holiday, nothing. It has been running every day. And Disha has handled over 5 or 6 lakh calls by now. And earlier we were the same system helped so much during the Nipah crisis, during the other pandemics, and also it's a basic friendly thing. You know why? For any illness that happens in a family, anywhere, any minor crisis, you can call Disha, and this will connect you to any doctor live. There are so many doctors who are willing to serve, and they'll be live all the time. Any emergency, 24 hours, a doctor will tell you what to do, what not to do. And other things, casual doubts and all that people could call during the daytime. Avoid the nighttime for casual doubts, because it's answered by doctors who are on duty 24 hours. And doubts, we will answer any kind of doubts about medicines, tests, prescriptions, rumors, everything. Any doubt we will answer. So it's a very vibrant and user-friendly helpline, Disha. So this helped during this time also, and in fact, this Disha also is linked up to the mental health division with 1,200 counselors and psychosocial workers who are helping so many people who are depressed because of lockdown and loss of jobs and all that. The health department also has its own radio program production facility where we daily produce programs, and it's broadcast daily on AM and FM stations of Akashvani. 9 or 10 stations relay these programs every day, including Sunday. Small 15-minute attractive capsules in simple language. It will be a good idea for all of you to find out when it is relayed in your district, through which station in your district, and you can listen to it on a car radio, in your office, wherever you are, on your phone, you can listen to it. Very, very useful, because it gives you health information which is so essential to prevent false, for making mistakes, getting exploited, and to ensure our family's health. Very, very good idea to listen to Arogya Keralam Radio Health daily. So it's just 15 minutes, but you gain invaluable knowledge about so many different diverse topics related to health. So our convergences were wide, health department and so many other departments. Elderly care, special care by social welfare, social justice department, baby care services by immunization division, psychosocial department by mental health, livelihood care by revenue department, food and grocery care by civil supplies, student care by the Department of Education, adolescent care by National Health Mission, COVID warriors care and morale boosters by many of our famous personalities in Kerala also chipped in together with us and gave motivational messages all the while to our people who are engaged in battle without going home, even going home. So many people were engaged in this multidimensional care. And also PMGKP, Pradhan Mantri Garib Kalyan Package. Any medical staffer, whether on contract by the government, whether a doctor or even a sweeper or attendant, who was giving COVID care, if they died, they would be given 50 lakh rupees as insurance. And we have been able to help five medical staffers from government contract have unfortunately expired. And we 6 people, I think, right now. And we have been able to give 5 of them so far the 50 lakh rupees insurance from the government of India. We have been able to give them, the poor families, though it's no compensation for the loved one, but it is something. Vaccination pros and cons. So pros, cons, and cautions. You know, vaccination is the latest hot news. In fact, we had a trial run recently where people, all the steps in vaccination is a huge process. But fortunately, we have our Health and Family Welfare Division, which has been doing routine immunization for so many years in Kerala. And Kerala is one of the states where it's done in the best manner possible. The most efficient vaccination system we have. And that same division and teams are looking after the vaccination here for the COVID also. Sorry to say, but initially vaccination will be given only for the medical professional because they are the people at risk. They are the people who, if they get laid up, then the whole state will suffer. The whole public will suffer if there's nobody to look after them medically. So initial priority will go to medical staff. It will be prioritized based on the rate of risk that they take. All kinds of staff according to the risk they take. And once all the medical staff are completed, that itself is 3.4 lakhs or so far registered. It might be up to 4 lakhs. After that only, then we will go to the general public. That too will be prioritized for people with what you call other diseases, diabetes, asthma, or maybe kidney disease, liver disease, heart disease. So these people will be hypertension. They will be given priority. And then people over 60. Then only after that, people under 60 will come in. Then finally, other groups of public also, healthy public. So it will be some time. We can't expect vaccination to happen on one single day or anything. It will take some time. And the vaccines are yet to arrive. They will be arriving very shortly. Our trial run or mock drill was very successful. Everything went off without a hitch. It was done to ensure that once the vaccine comes, we won't face any bottlenecks anywhere. And so much of preparation behind vaccination. 14 lakh syringes have already arrived. So many walk-in coolers and other things system. Because vaccines, the thing about vaccines is they're produced in ultra high-tech facilities using real rocket science, that kind of technology. And vaccines all deteriorate with cold temperature, so they have to be kept cold. So maintaining that sort of super cold temperature from a factory which is far, far away, right up to the body of the person who is receiving care, either in Kerala or in Assam or in Gujarat or in Kashmir. It's a fantastic task. And that is done through the cold chain system that we follow. And that Kerala has been doing with perfection. So whatever we are doing, we'll have the highest possible quality that we can assure the public and the doctors who are taking it. Non-COVID also was there to control hospital service for other illnesses. COVID means other things had also to be continued. And the other illnesses don't disappear when COVID was there. So there were so many hospital services that had to be continued. The field services and other surveillance activities for other diseases like dengue and chikungunya and malaria and all that was still going on. Then for consultation for people, this e-Sanjeevani OPD is a very good strategy that we employed. It's by the government of India, but we are the top user now. So using the system, anybody can log in. It's like visiting a hospital. you end up in a sort of hospital-like environment where you can choose what specialty you want to go to. You can choose gynecology, you can choose medicine, you can choose surgery. And then, you know what happens? It connects you to a doctor live, and finally the call switches to video, where you can see the doctor can see you. And so then you can talk and maybe show the doctor some sign like something you have swelling here or you have something in your eye, and not everything, but many illnesses could be solved by this e-Sanjeevani OP. I would recommend that you could try it out for the use of your family. So the address is esanjeevaniopd.in, and for those who want it in Malayalam, /Kerala could be added. Otherwise, esanjeevaniopd.in. And finally, last words on this presentation. It has been challenges all the way. I think we have never in our history faced so many challenges. For that, not only we, the entire state, the entire public. The public also has been behaving like an army. For most of the time, the public have been cooperating and going along with us. But sometimes there are people who don't obey, and those people have caused enough havoc also. We know that. A person who doesn't wear a mask puts everybody at risk. A person who doesn't maintain social distance puts everybody at risk. A person who doesn't wash his hands, that person puts everybody at risk. And they put society at risk. So we have been having all these challenges. Some of the challenges we lost, but mostly we were winning all the time. So I think our score is quite good. And we have gained a lot of confidence. But we have also been humbled that nature is something that you can't play with. And we have a new respect for germs and all that. They can't be taken for granted. See that now the new strain has come in. They are also very tricky. So you can never take an adversary for granted. So that also is a management strategy. Being complacent can lose the whole battle. So we have to be on a lookout all the time. Even when you think that you are on the best side, again, maintaining constant vigilance. I always compare COVID battle for the public to a kabaddi game. So when you go out of home, be very careful. It's just like going to the other team's kabaddi field. You go in there, but they are out to catch you. So we have to be careful and look around all the time, maintain all the rules, follow all the rules. So with that, I think I've reached the time now, crossed the time limit that Francis has said. So a lot of thanks for being so kind and bearing with me to in taking extra time here. So we hope that we will, in the days and weeks and months ahead, somehow come to defeat the virus and come back to a healthy time. But this experience has taught us that things can come like lightning. It can strike at the least expected place, unexpected place, unexpected time. So that way, let us hope we'll expect the unexpected. Look for the things that we never see otherwise. Keep our eyes open, keep our ears open, and take immediate action. So that's the watchword of the Department of Health Services and National Health Mission in Kerala. And that's for the public of Kerala. And thank you very much, dear guests, for listening to this. I think we'll have some questions and all that, Francis. So I think
Yes,
that is the presentation. We will stop the screen share now.
All right. Thank you, Dr. Amar. It was an extremely informative session. And, you and your team, you're the heroes of people. We all look up to you. It's amazing how much of coordination, interdepartmental coordination and diligence goes into controlling the pandemic. And Kerala, with you at the helm, Kerala has done extremely well in controlling the pandemic. So hats off to you.
Francis, I would like to make a little correction. COVID has been such a huge kind of battle that me at the helm is not how it worked really, because there were so many teams and everyone was working in a lot of convergence but independence. So for the earlier battles for H1N and all that, it was myself and a small team of 4 or 5 people doing all the stuff and having the full backup of our Director of Health Service and other people who gave us full freedom. Our Minister and Health Service Director and Secretary, everyone gave our small team full freedom. But this is such a huge battle. The scale is different. So here it's a huge team led by so many people. So I am also just one link in the whole thing. Though I sometimes act as a government spokesman and appear for the department, there are so many people who have been doing similar and corresponding work. So I will never say that I've been doing it. Every member of our team has been very, very what you call making so much of sacrifice and putting in so much of effort. So now we are all making these efforts.
Yes, of course, it's a teamwork and a fantastic one there too. But you played a very crucial role, nevertheless, and yeah, very appreciative. Thank you,
Dr.
Dr. Amar. We do yes. Xavier, sir, you were saying something?
Yeah, it was a very beautiful presentation. The only we could understand what are the role played by people like you. So wonderful, sir. We really appreciate your pain to control the pandemic in Kerala. Only because of people like you that the rate has come down in Kerala. So congratulations to you, sir. Thank you.
Dr. Amar, we have a few questions that are poured in. I'm going to read them out one by one.
Yeah.
The first one is from Anjana.
Yeah.
So what are the things that organizations should be doing in the coming weeks as it's undergoing mutations? I guess the virus is undergoing mutations. And many countries are going for a second lockdown.
Yeah, Anjana and everybody here. Thank you for that question. And it's a good thing that you asked that question because it shows us that we can never rest on our laurels. Now, at this point of time, the virus has shown that it is capable of having a small mutation. It's not a big mutation. It's actually what we call an antigenic or behavioral shift, behavioral drift, slight changes. More spreadable, they say, but the effects that it causes are the same as earlier. No increase in virulence or no increase in severity of the disease. So that is what we are seeing now. So that is, but still, we need to step up our caution. Now you will see for the past few days and weeks and months, people have lost the sense of urgency and caution. There are so many people now, because lockdown has been relaxed, people seem to be making full use of it. Agreed that everyone was under stress. So now going to gatherings and getting into crowds and celebrating so much might have very negative effects also. So the message out of what you asked, Anjana, for everybody is that we need to now step up our caution and not enjoy the relaxations too much. When the government permits a relaxation, am I audible?
Yes.
Yes, you are.
Yes, sir.
You are audible.
I think is some problem with the net.
Hello, Dr. Amar, can you hear us?
There'll be a lot of power cuts and probably his net is cut.
Possible.
It's been happening here also.
Okay. Let's give it a few seconds in case he's joining back.
I think he'll join back. Should give some time.
Yeah.
Or ask Dr. Krishnamurthy to answer that kind of questions. He's here.
Yes. Dr. Krishnamurthy. Yes, he's coming back. Dr. Amar is coming back.
Good.
Hello, Dr. Amar, are you back?
No.
Yes.
Yeah.
What's the question?
Okay, the next question. I don't know if Dr. Amar has joined back. Either Dr. Amar or Dr. Krishnamurthy can answer this question. Next question is, just give me 1 second. Do you think the COVID pandemic considerably changed the course of strategic management? It's a very generic question.
Yes.
Have I appeared online now?
Yeah. Yes, Dr. Amar, we can hear you.
Sorry about that because just like Murphy's Law, it now showed Murphy's Law really became true because my computer shut down and starting to restart or something. It has never done that during a presentation, but it has done that now. So I couldn't answer Anjana's question fully. So the basic thing was that is that we need to step up our cautions and follow the rules that we are saying and not enjoy all the relaxation. What we call personal lockdown. It's not enforced by anybody, but we need to do it for our own sake. So that is what we need to be are doing right now. So personal lockdown. So that is it. That is what we need to do now. Then so the next question, could you repeat that, Francis? Sorry, I
Yeah,
dropped my
it's
because of the computer mess.
It's a question from Shilja
Dr.
Shailesh.
Krishnamurthy? Okay,
Yeah.
okay.
A question from Shilja Shailesh. Sir, do you think the COVID pandemic considerably changed the course of strategic management?
Yeah, in fact, we have learned so many lessons because we have little mistakes we've been making all the time, in fact. And we have also learned so many lessons in strategic management about being real time on top of things, one thing, about building up supplies. These are things that we've been doing. Mainly, it's victorious lessons that we've been learning. The mistakes have been there, but they're pretty few in comparison. Mostly, we have been able to fine tune everything and get our public and our doctors. In fact, none of our doctors were engaged or equipped with dealing with this sort of thing. So we are able to ensure so much of compliance and all that. But initially, some people relaxed a bit too much, and that is how so many medical staff also got the disease. Here we are able to because your question is, the answer is yes. So many changes we have been able to make in the short time available, but it will be difficult to enumerate them or look after what. Basically, health management is now on an upscale in Kerala because we have our own State Institute of Health and Family Welfare. We have our own State Health and Health Resource Center based in Trivandrum, and these are agencies which look after the way that we manage health and the use of modern technology, modern communication methods. And for example, one change I will mention specifically is the training business, because we need to do so much of training for effective management. And all of the training now has been, we've been doing it on the net through Zoom and other meetings and WebEx meetings and all that. So now we have fine-tuned our strategy, we have changed our expenditure patterns, training expenses have been cut, and we are using those funds effectively elsewhere. So that is one example of real big change in strategy and utilization of funds and manpower.
Okay. The next question is from Blesson. He is a student of Elijah Institute of Management Studies in Thrissur. How did your experiences with other diseases help in the management of the COVID pandemic?
Elijah, vastly. The answer is hugely, because when 2009, you know what happened? Before 2009, just before, I think January of 2009 or so, we had this program in Delhi by the WHO about management of bird flu. Now, bird flu was pretty unheard of in the country at that time. It was a new influenza, and it was unheard of at that time. But we had this training program, and I was deputed by the government to attend that program. So after that program, in fact, the people in that program told us that all this imagination, things might never happen in your lifetime and all that. But within 2 months, the first pandemic, the first big pandemic in recent times broke out, H1N1. And so because I was only trained, we are only 3 of us from Kerala who had trained, and 2 people went into other services. So I was the only person, and so I was made the state nodal officer at that time. It was a trial by fire at that time, and I learned so many. I was just an ordinary pediatrician sitting in a hospital, looking after children and babies, and running an IC unit and all that in the government general hospital in Trivandrum, head of the department. I was catapulted from that seat into a hot seat of administrative management and pandemic management, what you call disaster management. So I learned so many lessons. In fact, one of the persons who helped me vastly was a person who belongs to Thrissur, one Dr. Jagadishan. Some of you might have heard of him. He worked in Palakkad for a long time as district immunization officer. Then he's been in the director of health services. My junior in years, but a huge guru-like person. So I will always credit whatever I've been doing to Dr. Jagadishan, because he has been such a wonderful guide to me in early times, and even now, as a confident, I go and we share so many difficult times together so that we get good ideas. So we have good mentoring. I think that is a very good thing. Everyone needs to have good mentoring and refreshing and some cool off time also. So under pressure, it's all good, but after too much of pressure, we tend to shut down. So cooling off time is also essential. That I've learned. Then other than communication, other than formal communication, I always used to call up people. So one thing I've learned is that whoever it is, senior, junior, very senior people, ministers, I used to make phone calls and talk like an ordinary person. So that I think paid off so much. That where we had to take difficult and painful decisions to junior people, disciplinary action. But I used to call them and talk and all that, so everything was softened, and it worked much better than a written order always. So that was another thing. Then transparency, as I said earlier, a lot of transparency. Transparency really paid off, and we gained so much of confidence of the public and also of the media through the transparency. So these are some of the lessons that we learned at that time, strategic lessons and changes.
Okay, Dr. Amar, we are running out of time, but can you take a couple more questions, 2 more questions?
Yeah, sure. I mean, your time is my time. I'm now at home. I've reached home, so unless something else happens, I'm sleeping. In fact, these last 2-3 days have been suddenly hectic because of the bird flu outbreak, H5N8. So it's another virus there. All the viruses are such naughty fellows. They keep on causing headaches for the Department of Health. So this bird flu came in, so I've been looking after that also.
Yeah, I want to make sure that we're sensitive to your time. The next question. Sorry.
Yeah. So your time is, you can take as much of time as you like. I'm happy to be with you.
All right. The next question is from, again, a student of Elijah Institute of Management Studies, Atulya Suresh. And the question is whether the new corona mutant will affect babies who have already been affected by COVID-19. I guess what she's trying to ask is if a baby has been infected by the earlier version of the virus, will the new version also affect the baby?
Whether it's baby or patient or adult or whatever, whoever, even if you get COVID once, what we have found out so far is that it can protect you for a short period in some people, not everybody. Some people get protected for a short period. Some people don't get protection. Some people get protection for a short period, say 2 or 3 months. Occasionally, there might be people who get protected for a longer period of time, but this is an average. And during that period, even if you are exposed to the same old COVID or corona, you can have a reinfection. That is one part of it. The other thing is that the new variant has slight differences. So that means it is more likely that one can also get that one if one is exposed. Anyway, right now we are fortunate because the new virus has been detected only in 9 people as of yesterday. And those 9 people fortunately were under airport. Right from the airport, we caught most of them, except for a couple of people. Everyone was put under home surveillance, home quarantine. And we were especially cautious to advise them very well to maintain that. And we hope that all these people have maintained the quarantine very well and not exposed to anybody else. And all the positive people with the new one, we have put them under institutional isolation.
Okay. The next one, I'm going to combine a couple of similar questions. One is from Mr. Paul VL of ESAF Bank. He has asked if there are a lot of messages.
Right now, your voice broke. So.
I don't know what's. Is it okay now?
Yeah, it is about the vaccination.
Right, it's about the vaccination.
Now it's clear. Yeah.
Okay. There are 2 questions, similar questions about vaccinations from 2 different people. One is from Mr. Paul VL of ESAF Bank. He has asked, there are a lot of thoughts and counter thoughts about the vaccinations, the good side and the bad side on social media. So what are your thoughts on the vaccinations? And a connected question from Mr. Ragesh Parameswaran is how, since there's a new mutation of the virus, how effective is the vaccination going to be?
Vaccination is a process that is now about nearing 300 years in age. Started off with Edward Jenner, who devised the first vaccination against smallpox. And we have gone through a lot of landmark developments in the vaccination field. And now our vaccines are all produced after so much of research and development and backup. And safety is of prime importance. So we can say that most of or every vaccine that has been, it's only after the safety is proved that you get a license for vaccination. Because we have to keep in mind that vaccine is something that we are giving to a healthy person who does not have a disease. So then we cannot afford to give a person, put that person at harm. So because of that, our vaccines are ultra safe. Now, there is always a group in the world who always say that nature is better and vaccines are all dangerous, and then if you take vaccine, you will get this and that and all these things. In fact, huge damage has been done by these people. In fact, I still remember that there were people, young people, adolescents and teenagers and youth who died of diphtheria in Kerala. And we found that most of these people who died, they were all unvaccinated or partially vaccinated because of the influence of these notorious people who tell the public such stories and make them believe that they are doing the right thing. So what the motive is, we are yet able to, are unable to fathom why they are doing this thing, but they seem to derive some joy out of exposing people and reducing their protection. So vaccines are mostly safe. No vaccine is 100% effective, number one. Any vaccine will have a minute amount of risk that is there, even not only a vaccine, even if you get out and walk on the road, there is an element of risk, but that does not mean that nobody ever gets out on the road or does not drive or does not fly. We all do all these things knowing that there's an element of risk, but we do it in the better public interest and our safety interest. We keep it on top. So vaccination will be there and it is safe enough, and all these things are done in the best of faith. Now, whether with the new strain will the vaccine protect? So far, the evidence has been, or the initial evidence, you can only say initial because now we are in a sort of fast mode. Earlier, all these things used to take years and years and years. Now everything is happening within 12 months or 11 months. Now, what evidence we have and what the vaccine researchers are now showing us is that the vaccine protection that can be had from the vaccine against the new strain also seems to be good. So we will wait and see what happens. But the one thing that we should keep in mind is that even if one takes a vaccine for COVID, for example, one should not abandon the caution. This I am saying because I have had friends, including doctors, from telling me that vaccination എടുത്തു കഴിഞ്ഞിട്ട് വേണം മാസ്ക് ഒക്കെ ഊരി എറിഞ്ഞിട്ട് ഒന്ന് സന്തോഷമായി നടക്കാൻ. It's a very dangerous trend, even as a joke, because the moment you relax, because when we say that vaccine has 70% efficiency, that means 20% people might not be protected. You never know who is protected and who is not protected. So then a person who relaxes the cautions and acts carelessly is taking a lottery ticket where the first prize or the bumper prize is death or disease and death. So one cannot afford to take the risk for oneself or for one's family. So vaccination is there, it will protect, but still the caution has to be maintained.
All right. I think we'll take one last question. It's from CMA Madhu, who is a member of TMA. It's about social distancing versus sanitizing and wearing a mask. What is more effective? Because social distancing is practically not very possible, especially in public transport and public places. People don't. It may not be conducive to maintain. It might not be always possible to maintain the social distancing. So his question is really, what is social distancing as important as sanitizing and wearing a mask? And is it proven that COVID is an airborne disease?
Yeah, you know how this physical distance comes in, because COVID spreads basically when you cough or sneeze, basically initially, but also it can spread when you speak also. So when you speak, there's a small halo around you of the viral particle, the particles from your throat. It's a mist-like thing which you don't see. But in cold weather, when you breathe, you can see this area of clouding in front of you. That sort of range when you speak. But when you cough or sneeze, these particles can go as distant as 1 meter. And that is why we say be out of 1 meter, be more than 1 meter away. Because by that time, the particles directly will not enter your nose or mouth from some other person. If you are at least 1.5 meters away, they will go and deposit it somewhere, and that is why we insist on hand sanitization. So it is complementary to using a mask, hand sanitization. So all these three things, physical distancing, hand sanitization and mask, all three are complementary to each other. So without one, the others will work much less. So when we make a sambar, we need the sambar powder, we need the vegetable, and we need the water. But with water alone, if you try to make sambar with the vegetables and sambar powder alone, you will not get a sambar. Or suppose you use water and just vegetables, you will not, and without the sambar powder, you won't get it. Or you just mix sambar powder and water, no vegetables, you will not get a sambar. So it is like that. Everything has to work together.
Okay.
It is airborne. COVID is airborne.
Hello, Francis.
Yeah, one more question from Amira Naushad. I think it's an important one.
Yeah.
What resources are available to help mitigate the workplace risk? I suppose she is asking about the government resources or the health department's resources.
Could you repeat that question once more, because the voice is breaking?
What are the resources available to help mitigate workplace risk? What resources are available to mitigate the workforce
Francis,
or
sorry,
workplace
your voice is
risk?
breaking.
Oh, okay. Can somebody read out the question, the last question in the chat window?
Yeah. What resources are available to help mitigate the workforce or workplace at risk?
Yeah, okay. I get that. Yeah. If you mean educational resource and all that, there are so many guidelines which are published on workplace risk mitigation, which are there on different sites. One is National Center for Health Disease Control, that is called NCDC. So if you type NCDC on your computer, on your net and Google NCDC, National Center for Disease Control, ncdc.gov.in. So that is one resource. The other ones here in the Directorate of Health Services Kerala, things which are Kerala specific you will get. So it is www.dhs.kerala.gov.in. So that is for Kerala state specific things. Then we have a dashboard, GOK dashboard. So there you can see the data for what is happening. And and then also you can also refer to for a wider perspective, you can also refer to who.org. These are the places, but I would recommend that preferably go in the order. First, look at the Kerala guidelines, because our own conditions are quite different from what other states might be having. So first, look at the Kerala guidelines, then go in for Government of India or NCDC guidelines and Ministry of Health and Family Welfare, MOHFW, Ministry of Health and Family Welfare, .gov.in. And then last thing, one can look at the WHO and the CDC guidelines for such recommendations. The workplace, basically, one thing I would like to stress is that lunch hours, dangerous time. Because at workplace, one has to insist on everybody using their masks and having a lot of sanitizers in the workplace. Also have disinfectant liquid at every work table and workstation, workroom, so that people and employees and officers can disinfect and wipe their own table and chair. Don't wait for a cleaning staff or cleaning staff member or some attender or janitor to come in. But one has to develop the culture, just like Japanese, of wiping one's own table and chair and other things frequently. Phone, switchboards, door handles, everything. And we say don't leave the doors closed, always leave the doors open, so that nobody has to push a door handle to come into your room. And lunch hour is one time when people start relaxing and talk all the time during lunch. This has to be changed in the new normal. Lunch, people have to sit quite apart, at least 2 meters apart. And as far as possible, quietly eat and don't talk during that time. And once the eating business is over, you can put your mask back on and then start the talking and relaxing. This is something is a new normal. We are not used to it. We tend to talk during lunch and tea break. That should not be done because it's a venue of transmission. And that is how office transmission often happens, lunch break and tea break transmission. Many people might not be aware of that. And please be aware that speaking also can transmit the virus. It's not just coughing and sneezing. Speaking can transmit. So when you wear a mask, it should be a proper mask. It should come right up to the nose, up to here. It should not be at the tip of the nose. Now, most of the masks I see in the market remain at the tip of the nose. 1 millimeter down and your nose is out. So it should not be like that. It should cover right up. Use the old-fashioned mask, that is much better. And it should go below and right up. And also one more thing, one does not need to use N95 mask, everyone. Preferably go for the homemade or reusable mask rather than the disposable mask which people again keep on throwing away. Just some points because time is short, that's why I'm trying to condense everything.
Thank you.
Good job.
Thank you, Dr. Amar. Before we conclude the session with a vote of thanks, Dr. Amar, can I request you to stay back for, Dr. Xavier, the president, would like to distribute certificates of membership for the new members. So,
yeah,
Dr. Xavier, over to you.
Yes, Dr. Sushila Menon, Captain Sushila Menon. She's the former professor of Sri Kerala College. This is a digital form of our certificate. Please accept. Then CA Rajesh Parameshwaran, again a elect member. Please accept our membership. Then Lieutenant Colonel Rajendra Babu, MK, SM, elect member. Sir, please digitally accept this membership. CA Krishnaraj P is also chartered accountant. Please accept this membership in the digital form. Mrs. Rashmi Madhu, wife of CMA Madhu, please accept this certificate in the digital form. Then it is a time for presentation of memento as a token of our love and affection to the chief guest. Again, virtually we are passing this memento to Dr. Amar as Fettle. Sir, please accept our memento. It will be sent to you by courier later.
Thank you. Thank you so much.
Thank you, sir. Thank you.
Okay, thank you, Dr. Xavier. May I now call upon the Honorary Secretary of TMA, Pratap Varki, to deliver the vote of thanks.
Pratap,
Unmute.
unmute and tell.
Unmute. Pratap.
Okay.
You're on mute, Pratap. I don't know. I think we may have lost him.
I think out of network, I think.
Yeah, I guess. May I request Dr. Xavier, the President, to deliver the vote of thanks
Yes.
in Pratap's absence.
So it was a wonderful day and you did a very great job. You really gave the cautions to be taken in order to prevent this viral disease. Thank you, sir, for spending the valuable time. You spent here more than 1.5 hours. Thank you very much. Whenever we have some doubts,
Yeah.
we'll be calling you again and again. Thank you very much. And also, this program is sponsored by Mr. K.R. Raju. And I take this opportunity to thank Mr. K.R. Raju for sponsoring this event. And also, there are our office bearers and students from Elijah, students from other colleges. And I take this opportunity to thank them all. Thank you very much. Okay, with that, we conclude this session.
Okay, thank you, everyone. Have a good night, good evening. Thank you, Dr. Amar, once again.
Thank you. The meeting is adjourned. Thank you.